Before we get underway, I'd like to speak on a personal note about an employee here in Howard County who we lost, Laura Wetherall, who was not only a county employee for 34 years, Employee of the Year in 1998, a bureau chief with Recreation and Parks, but she was a friend. She was someone who had not only an infectious laugh and smile, someone who cared about our community greatly, served admirably, and always ensured that the voiceless had a voice. On behalf of the co-workers who loved her and who now feel a sense of loss, and the tens of thousands of residents who she impacted because of her dedication in recreation and parks, I want to send our prayers and our sympathies as we lost an impeccable leader. This loss also reminds us of the devastating toll that COVID-19 has had on our community and the more than 500,000 Americans who lost their lives. It's a reminder that these aren't just numbers, these are people, and these are lives, and these are holes that are going to be left in our society for years to come. Well, over the past several weeks, we've seen an encouraging downward trend in our COVID-19 key metrics. We mustn't forget the loss to this impact. We've seen our positivity rate in Howard County dipped last week to 3.8%, below 4% for the first time since November 8th. And we are able to hold this rate even today. Our case rate per 100,000 residents dipped significantly and is now at 11, the lowest it's been since November. And I'd like to thank all the residents and businesses who have worked vigilantly to adhere to mitigation measures and to keep one another safe. This is a great progress, and we must stay focused to continue to see a decline. We've also made significant progress on vaccine distribution here in Howard County, and to date, 50,000 of our residents have received their first dose. More than 20,000 of those doses have been administered by our health department and our partners assisting. That's approximately 15% of our population who have gotten their first shot and 6.6% who have gotten their both doses. We're seeing increased vaccine confidence in the 1A group of healthcare workers, emergency personnel who will continue to be vaccinated. And we're all still working through phase 1B, which includes our 75 plus, our super seniors, our public school system employees and educators, private schools, higher ed, and child care. I'd like to personally and publicly thank Dr. Martirano for his continued effort and all of our educators who are working to get vaccinated as quickly as possible, as well as Johns Hopkins and all of our partners at Howard County General for providing additional doses to make this possible, and of course, Dr. Kate Hetherington and the team at Howard Community College who have been amazing partners. Phase 1B also includes residents who are developmentally disabled, and I'm especially proud of our Mobile Integrated Community Health, or MICH team, and the intergovernmental collaboration between the Department of Fire and Rescue, our Health Department, and our Department of Community Resources and Services, who are working to vaccinate some residents in this population in their homes as well as other facilities. To date, 60 individuals with developmental disabilities have been able to get vaccinated in their homes. Additionally, this week and moving forward, the MICH team will visit an independent living facility and congregate care facility each week to administer vaccines. On Saturday, the health department hosted their Super Senior Saturday for second doses, fully vaccinating approximately 2,300 of our residents over 75. Staff seamlessly worked together on this second dose clinic and were able to meet many residents with mobility issues in their vehicles for a smooth appointment. And I can't stress enough how critical it is for our residents to ensure that they have both doses to this vaccine. The effectiveness of the Moderna and Pfizer vaccine is currently based upon a 2-dose regimen. After you receive your first dose, you will be able to schedule your appointment for your second dose, and please be sure to show up. We want to make sure our residents are fully vaccinated and do not want any of those doses going to waste. We know that many in our community are eagerly looking forward to getting vaccinated, and I am encouraged to report that next week our health department will be hosting specific clinics for our 65 to 74-year-olds who are in 1C. And as supply allows, clinics will open up to additional groups in 1C. Now, we've made progress, but our health department has continuously received an underwhelming supply, while statewide sites and private providers are often seeing increases. Our allocation has decreased over the past 3 weeks. 4,500 vaccines were provided during the starting week, January 24th. The following weeks, we received 2,000 doses, and now we're down to 1,700. The state has provided a 4-week look ahead, and Howard County is slated to receive only 1,700 vaccines in the next 2 weeks, as we did the past 2 weeks. Last week, though, we already faced setbacks. As experienced statewide, we did not receive the 17,000 first doses that were supposed to be allocated to us due to winter weather, but we continue to make adjustments accordingly. Right now, residents in all phases have the ability to pre-register with the Howard County Health Department at vaccine.howardcountymd.gov. If you pre-register, you will be notified when your group is eligible and supply is available. Residents who are currently eligible for vaccine throughout the state are also encouraged to visit marylandvax.org to find more than 100 providers who are offering appointments. Despite these challenges, Howard County is well equipped to adapt to changing supply and quickly stand up clinics as needed. We continue to be one of the most efficient and effective jurisdictions at getting shots in arms. As of yesterday, our health department has administered 111.6% of our received first doses. And we continue to administer 100% of our vaccine within about a week and exhaust our supply each week. We promise to continue providing updates, keeping our community informed, and advocating for additional vaccine so that all of our residents can safely receive the vaccine as soon as possible. Thank you.
Thank you, Angela, and thank you to Dr. Ball. We are so fortunate to have your leadership during this very challenging time, and your calm and steady way of giving us information clearly, providing it in a very transparent way is appreciated by all of us. Howard Community College is proud to partner with Howard County government and the health department in our collective effort to protect the health and safety of our community and to help bring an end to the coronavirus pandemic. From the beginning, Howard Community College has been doing its part from donating equipment and putting students and faculty on the front lines to serve at the mass vaccination clinic site here at HCC. At this time, with so many community members coming to campus for vaccinations, we want to ensure that everyone has important information about navigating to and from the vaccination clinic. On the days the clinic is open, the college closes its Hickory Ridge Road entrance. All traffic is routed into the front of the college off of Little Patuxent Parkway. We ask the community to be patient with this change that helps ensure the smooth flow of traffic. We ask community members to check the health department's vaccination site for the correct location of the clinic, and please use 4950 Campus Drive, Columbia as an alternate address for the college. Since March of last year, Howard Community College has been offering most of its classes virtually. As we plan for summer and fall, we anticipate adding more courses in a hybrid manner, which is partially online and partially in person, as well as in-person classes. At the same time, we look forward to the day when the availability of vaccines will support the vaccination of our entire workforce. Higher education is now part of the 1B phase, so we will continue to collaborate with Howard County to ensure the protection of our employees. Thank you.
The health department continues to face ongoing challenges related to vaccine availability and supply. In order to assist with clinic planning, the state of Maryland advised each jurisdiction the amount of vaccine that would be allotted for a 4-week period. And as County Executive Ball mentioned, Howard County has been allotted 1,700 doses a week for the next month, knowing that this is subject to change. This amount does not allow us to make substantial impact on the numbers of people who are currently and patiently enrolled in the pre-registration surveys. There are more than 250,000 residents who have registered in these surveys. Understandably, we share the frustration that everyone has. Please be aware that despite this, we continue to hold clinics getting vaccine to as many individuals as our supply allows safely, effectively, and per prioritization of public health. We face the additional challenge of distribution delays this week due to Mother Nature and the weather faced in the South and the West, and even here locally. For that reason, we were forced to postpone yesterday's clinic and reschedule for March 2nd. Those affected by the change should receive multiple notifications. Information about our clinics is sent by Howard County Health Department to your email, phone, and sometimes text using several methods. You may see upcoming clinic notifications that come from something called Everbridge or a call from a 410-313 Howard County government phone number. Be aware of these to help ensure that you don't miss our message or our clinics. We also post information on our website. In addition, you may also receive email reminders and confirmations from a sender that says PrepMod. This is the official state vaccination registration system and will contain vital information about the upcoming clinic. Please keep an eye out for these clinic registration confirmation communications. And if you do have questions, because I too haven't paid attention to things that I think are spam, you can contact us. While we work to hold clinics with our current allotment, we encourage everyone to take advantage of other vaccination opportunities that are available in the state and are being held at the M&T Bank Stadium, Baltimore Convention Center, or Six Flags. Our website vaccination page has a link that will take you to the state's COVID Vax Finder page where you can query for a site near you. Finally, when you are able to get a vaccination appointment, it is critical that you receive both doses to fully protect you from COVID-19. Administering vaccine to people each week is a complicated process, especially given limited supply. We cannot guarantee that we can reschedule your appointment. We urge everyone to make every effort to arrive at the assigned time. If you have an appointment, no need to come early. If you cannot make your second appointment, as we do know emergencies arise, please let us know as soon as possible, and of course, we will work with you. Thank you for your continued support.
Good morning, everyone. I appreciate the time provided by the County Executive, Dr. Ball, to speak directly with the Howard County residents and to provide an update on vaccinations of the Howard County Public School System staff. Many staff members, as you know, will return to their schools and offices tomorrow in preparation for the first group of students returning to in-person instruction on March 1st, and for that I'm extremely excited about that. Last week, we surveyed staff to gain a clear picture of how many of our staff have received at least one dose of the vaccine or are scheduled to receive it. How many of our staff are still waiting for an appointment to receive their first dose, and how many are electing not to be vaccinated at this time? To date, the Howard County Health Department and Johns Hopkins Medicine have administered a combined 3,700 first doses of vaccines to the Howard County Public School System staff. Staff have also been able to receive the vaccine through providers outside of the two affiliates with the Howard County Public School System. Based upon our latest data, approximately 60% or 6,000 of our total workforce for the Howard County Public School System has received either the first dose or are scheduled to receive their first dose. And those are very, very encouraging numbers. As many of you know, the vaccine distribution plans continue to be solely dependent on the availability of the vaccine in Howard County. I am encouraged by the emphasis placed at the national and state levels to accelerate the pace of the distribution, but reminded our staff and community to remain patient. While our timeline for hybrid has been moved up, we have heard from the health experts, including Dr. Rossman, that there is a way to ensure the safe return to schools and that the status and the pace of vaccination administration should not be an impediment. I appreciate the hard work and effort by the Health Department and Johns Hopkins Medicine to vaccinate our staff as quickly as possible. And to you, Dr. Ahmed, I say thank you once again. Additionally, I want to recognize our Health Service Coordinator, Carrie Wegeman, and every member of our school system's health service team that you can probably see behind us. These exceptional staff members have demonstrated remarkable energy, expertise, and commitment in staffing the vaccination clinics for our staff and informing the health and safety measures that are being implemented in our schools and office buildings as we prepare for the safe return of students and staff. We deeply appreciate their tireless efforts in keeping our students and staff healthy and safe. Additionally, I want to assure our community and our school system community in particular that the correct supply of PPE, personal protective equipment, has been provided to all schools based upon the guidelines provided by the Centers for Disease Control and Prevention. Sufficient quantities of PPE are being provided to meet staff and student needs throughout the remainder of the 2020-2021 school year. I encourage the community to visit our website to view the frequently asked questions that are constantly being added. The site is accessible at our website at www.hcpss.org. In conclusion, I look forward to providing additional information as we progress through the questions today, and I am so excited to begin welcoming our students back to school safely on March 1st, 2021. Thank you very much.
Good morning, and thank you. Howard County General Hospital continues to see a decline in COVID-19 patients, although since the beginning of the second surge, we have been quite busy with this. It has been really heartening to see that we have been seeing less infections overall, although we are still taking care of a number of patients that have COVID-19 in the hospital. This is a time to continue to be vigilant as the public and make sure that you are wearing your mask, continuing social distancing, and doing appropriate hand hygiene practices. It is not a time to relax and say that COVID-19 is not in the community. It is still here. We have been fortunate that we have been seeing a decline in those admissions, so we are very happy with that news. We've been continuing to help, as Dr. Martirano mentioned. Johns Hopkins Medicine, specifically through the Howard County General Hospital site, has been able to vaccinate teachers and help with that process as well. Although our vaccine allotment is decreasing as time goes on. As the state directs and makes decisions about different sites, the hospital sites, and specifically ours, are receiving less vaccine than we did prior. And hopefully we will find other places where vaccinations are given. And we certainly applaud all the great efforts by the county to continue to deliver vaccines as they are. We are continuing to do our frontline employees and making sure that we have second shots for new employees and employees that have already been established as well. So we are continuing to partner with our great partners in Howard County government, the health department, the schools, and working to get through this pandemic. So we appreciate all of your patience, and thank you very much.
As you know, the Department of Fire and Rescue has been operationally supporting our partners at the health department with vaccination at their clinics like the one we are at today. But over the past week, we have begun vaccinating specific groups of residents through our mobile integrated community health program in concert with the health department and the Department of Community Resources and Services Office of Aging. Those residents identified are adults with developmental disabilities that are in congregate living facilities, along with our seniors in independent living facilities. Last week, we provided on-site vaccination at 2 of these locations throughout the county and vaccinated 40 residents as part of this program. This represents approximately 27% of the occupants of those 2 facilities that could potentially be vaccinated. And while those numbers are still low, and we are in the early stages of this operation, we will continue our efforts as more vaccine becomes available, and we encourage our residents to continue to sign up to receive the vaccine. We have also continued our efforts to vaccinate homebound adults with developmental disabilities through a parallel program in our mobile integrated community health. Since we have begun this, we have successfully visited 50 homes and vaccinated 60 additional residents in the community. It is important now to remind our Howard County community that if you have questions about your ability to be vaccinated, to please call the Howard County Health Department COVID-19 information line at 410-313-6284 or visit the website. We will continue to work with our partners to ensure that all county residents who want to get a vaccine have the opportunity to do so. Thank you.
Thank you, and good morning. DCRS continues to increase its ongoing commitment to support our county's vaccine efforts in the following ways. Our current focus remains on our older adult population, those living with disabilities, and those who are most vulnerable in our community. On February 17th, we launched the program targeting outreach to older adult independent congregate living facilities, or ILFs, as both Dr. Ball and Chief Anishevsky have indicated. In an effort to coordinate on-site vaccine clinics, our team is working with outreach efforts to these facilities. There are 31 of these such locations in our county that meet the current definition of ILF. Our Office on Aging is coordinating the outreach efforts to each of these property management companies for an opportunity to determine the number of residents in those facilities and to schedule vaccine clinics on site. And then working alongside our partners in the Mobile Integrated Community Health Team and the Health Department, we are on site with them to conduct the vaccinations. During our launch on February 17th, we visited 2 locations, Shalom Square Apartments and St. Matthew's House, where we were holding our first on-site clinic sites. 40 individuals, as Chief indicated, received their first dose of vaccine at these 2 locations, including staff who support those facilities each day. This is yet a small number to begin with, but an important one. And we want to encourage people to please get the vaccine when we're coming on site to provide it for you. The important goal here is that we want to vaccinate at a minimum 1 ILF location per week contingent upon vaccine supply. Additionally, as of last week, our Maryland Access Point team members helped to field more than 3,000 COVID-related calls, and our department staff continue to work side by side, the health department and the MICH team, in locations such as this, in on-site clinics, to provide information and assistance and support to those who need it while on site. Our goal in everything we do is to make sure that residents feel heard, respected, and get the support that they need during this process. Thank you.
Thank you. And now we'll take questions from the press.
Joe? Good? Anyone?
Yes.
Okay.
Mr. Executive, you said there was a disparaging number between your county and other counties getting vaccines. What do you attribute that to?
The question is, what do you attribute the differences in the numbers of vaccine coming into the county?
So I think the state is working through a process and evaluating. I think we continue to hear the factors that they consider when it comes to vaccine distribution, such as efficiency, the other hospitals in the county, and what have you. But frankly, we're going to continue to advocate for more vaccine. I still believe that having our local health departments and our hospitals as the primary, while there is so little vaccine, makes the most sense. However, I do recognize the importance of building an infrastructure so that when we do have increases in doses, as we hope is on the horizon for the coming weeks, we are able to make vaccine as quickly and safely available as possible.
Question for the hospital. It seems that a lot of the reactions are based about how the hospital facilities are. How are you guys doing?
The question to the hospital is, how is the hospital doing regarding various reactions from the community?
If you could just clarify, when you say reactions.
Not reactions, the community.
Yep.
A lot the way some of the counties and governments are basing, we're worried about the hospitals being overwhelmed. How are you situated right now with your beds and COVID patients and others?
So that's a great question. So I think based on the number of COVID patients that we've had, when we looked at the start of the second wave, we were probably about half of those numbers of COVID patients that we had at the beginning. So that's a lot better for us, and that means that we can accommodate all regular patients. So we are, as a state, seeing less and less COVID admissions, so we're in a much better place than we were back in November.
Are you worried about some exaggerated spike coming back?
I think it's always possible when you talk about variants that are out there and whether or not, people will continue to do social distancing and work those things. So we always have to be wary, and we're ready for those situations, but I don't anticipate, based on current modeling, that we will see that in the next few months.
Any other questions? Thank you. This now concludes our press conference.